Welcome to the Health Headliner podcast by Tudu Digital. Our content is informational only and not medical advice. Please consult your provider. Now, let's dive into today's headlines.
It's kind of wild when you look at the numbers for bird flu cases in the U.S. Like back in 2022 and 2023, there was only, one person each year who got infected with H5N1 avian influenza.
Yeah.
But then, just in the first part of 2024, that number jumped to like at least 67 confirmed cases.
Wow, that is a huge jump.
Yeah, 67. I mean, that kind of makes you stop and think, what's going on here? And what does it actually mean for us?
Well, that's exactly why we're here today. We're diving into all of this. It's not just some, random blip in the statistics. It really seems like something's changed with how this avian influenza virus is acting.
Right.
So we've been, looking at all these recent reports, expert analyses, trying to get a grip on this whole situation, how it's spreading, what the potential dangers are, and most importantly, what you need to know. And we're going to do our best to give you the clear picture without, bogging you down with all this super technical stuff.
Absolutely. We want to make this clear and relevant, something everyone can understand and use. So where do we even start? Like, what's been happening that explains this sudden surge in cases?
Well, one of the biggest things we've seen over the past year is this significant spread of the virus in animals. We've seen these devastating outbreaks on poultry farms, millions of chickens dying, and that, of course, leads to what we're all seeing, higher egg prices.
Yeah, definitely noticed that at the grocery store.
Right. It's hitting everyone's wallets. And it's not just poultry. It's been found in a lot of cattle herds, too. Hundreds of them across the country.
Oh, wow. Hundreds.
And what's really got scientists worried is that some cattle in Idaho, they actually got infected twice. Not just once, but twice within a pretty short time.
Wait, so they got it, recovered, and then got it again?
Exactly, and that's not a good sign. Dr. Elizabeth Jacobs, she's a professor who specializes in infectious diseases, and she says this repeated infection is a big red flag. It basically means the virus is sticking around. It's circulating within these animal populations, which means more chances for it to change, to mutate.
Because viruses, they're always evolving, right?
Yeah.
Changing, adapting.
Yeah, they're constantly changing. And the more they replicate, the more they spread, the more likely they are to develop new characteristics. And what everyone's worried about is it mutating in a way that makes it way more dangerous to humans, like being able to spread easily from person to person. Right now, the main way people are getting it is directly from infected animals.
So the more it spreads in animals, the higher the chances of it becoming a human-to-human thing.
That's the fear, yeah. And it's not just about, the virus itself. There's also the question of what people understand about all this. We looked at some research about public awareness around raw milk, and it's kind of concerning.
Raw milk, how does that fit into all of this?
Well, the Annenberg Public Policy Center did this survey to see what people knew, right? And they found that a lot of adults in the U.S. don't realize that drinking raw, unpasteurized milk is riskier than drinking pasteurized milk. A lot of people weren't even sure if drinking raw milk made you more likely to get foodborne illnesses or specifically bird flu.
So there's some confusion about the risks involved.
Definitely. And what's even more interesting is that most people didn't know that bird flu so far has only been found in raw milk samples, not in pasteurized milk, the kind that's been heat treated to kill off harmful stuff.
So pasteurized milk is safe, at least for now.
As far as we know, yes. Another thing the survey found is that a lot of folks didn't know that young children are especially vulnerable to getting sick from the stuff that can be found in raw milk. Their immune systems aren't as strong.
It's really interesting how much this ties into food safety and what people know about it. But going back to the bird flu itself, what do the actual numbers tell us? How many people have gotten sick and where is it spreading?
So the Centers for Disease Control and Prevention, they're tracking all this. And as of March 2025, they've confirmed 70 cases of bird flu in people across 13 states.
70. That's more than I realized.
Yeah, and almost all of them were in people who'd been in direct contact with infected animals, mostly poultry or cattle. Sadly, there's been one death reported in Louisiana. But the good news, I guess, is that so far there's been no confirmed cases of it spreading from person to person.
Okay, so that's at least somewhat reassuring. But what about the animals themselves? How widespread is this in different animal populations?
It's pretty bad. They found it in nearly 1,000 dairy herds in 17 states. And in poultry and wild birds, it's even worse. Over 166 million birds have been affected nationwide.
Wow, 166 million. That's hard to even comprehend.
Yeah, it's a staggering number. It shows you how far this has spread.
It really does. We also looked into a survey about how parents are feeling about all this. What were some of the key findings there?
Right. So the University of Michigan Health, they have the C.S. Mott Children's Hospital, and they did a national poll to get a sense of parents' concerns. And a lot of parents said they felt like they didn't have enough accurate, up-to-date information about bird flu.
That's understandable. It's a lot to keep up with.
Absolutely. And a lot of parents were worried about it spreading from animals to humans and also about the possibility of it spreading between people.
Those are definitely valid concerns, especially with kids involved. Did the poll say anything about how confident parents felt about, like, the government's response to all this?
Actually, a lot of parents said they had low confidence in the government's ability to contain an outbreak and give people good information about it.
So there's a trust issue there. That's something we see with a lot of public health issues these days. Did the poll ask about where parents were getting their information from?
Yeah, and most of them said they were getting it from news reports, followed by social media and just searching online. Not so much from official sources like government health agencies or even their own doctors.
That's interesting. It seems like there's a disconnect between where the most reliable information is and where people are actually getting it.
Exactly. It highlights the need for better communication. Clear, accurate information coming from sources people trust. And speaking of information, the poll also found that some parents were doing things to protect their families that, well, might not be based on the best evidence.
Like what kinds of things?
About a third of parents said they were doing things like being extra careful with hygiene, which is good. But some were also being overly cautious about handling raw eggs, chicken, and beef, even cutting back on eating cooked poultry.
Which isn't really necessary, right? Properly cooked poultry should be safe.
Right. It seems like there's some fear driving those actions, maybe not fully understanding how the virus is transmitted.
So we've got the situation where the virus is spreading more in animals, more human cases popping up, and a public that's maybe not fully informed and had some understandable concerns. Let's shift gears a bit and talk about what all this could mean for the future. What are the potential implications here?
The biggest worry is that this avian influenza virus could evolve into something that can spread easily and sustainably between humans.
That's the worst case scenario a lot of people are thinking about, right?
It is. And Dr. Jacobs pointed out that what we're seeing now, the way the virus is spreading in animals and jumping to humans, it's kind of similar to what's happened with other viruses that eventually gain the ability to spread easily between people. Every time the virus infects someone new, it's another chance for it to adapt, to change.
It's like rolling the dice. The more you roll, the higher the chances of getting that one specific number you're looking for.
Exactly. And right now, it's mainly spreading to humans through close contact with infected animals. So there are certain groups of people who are at much higher risk.
Like people who work with animals, right?
Right. People who work on poultry farms, in the dairy industry, vets, anyone who's regularly around these animals. They need to be extra careful, follow all the safety protocols to protect themselves.
What would it mean if the virus did start spreading easily between people? Like, what would be the impact?
Well, that would be a major public health crisis, for sure. If it became a human-to-human thing, it could spread very quickly through communities. We could see widespread illness, potentially even deaths.
That's definitely a sobering thought. It makes you think back to the coronavirus pandemic and what we learned from that.
Professor Richard Carpiano, he's a public health expert, and he actually talked about that. He said the coronavirus pandemic was like a wake-up call. It reminded us that these new infectious diseases are a real threat.
We can't just focus on the chronic illnesses, the things we've known about for a long time. There's always the possibility of a new virus popping up and changing everything.
Exactly. And he also talked about how interconnected everything is. Human health, animal health, the environment, they're all linked. What happens in one area affects the others. We can't ignore that.
Like we're seeing with the egg prices, right? That's a direct result of the virus spreading in chickens.
Exactly. That's just one example of how something happening in the animal world can have real, tangible consequences for all of us. Professor Carpiano also said that it's more important than ever to invest in public health, Make sure we have good systems for tracking diseases, testing, developing vaccines, and communicating clearly with the public.
All those things we saw were lacking during the coronavirus pandemic, right?
Right. We need to learn from that experience, both the good and the bad. He also talked about the importance of public trust. Like, how do we make sure people trust the information they're getting from the government and health officials?
That's a huge issue these days. There's so much misinformation out there, and it can be really hard to know what to believe.
Yeah, and when you add in the fact that so many issues have become politicized, it makes it even harder for people to trust the science.
So how do we fix that?
Well, Professor Carpiano said that clear, consistent communication from public health agencies is key. They need to be transparent, they need to be proactive, and they need to address misinformation head-on.
It sounds like a tall order, but it's clearly important. Did he talk about anything else related to public trust?
Yeah, he brought up an interesting point about political leadership. He said that if people who have, a history of questioning established science, like the safety of vaccines or the risks of raw milk, if those kinds of people were put in charge of public health agencies, it could really damage public trust. He used Robert F. Kennedy Jr. as an example, just hypothetically, of course.
Right, because those are both relevant issues with this bird flu situation. Vaccines and raw milk. Interesting point. Is there anything else Professor Carpiano highlighted?
He also talked about farm workers and how they're in a particularly tough spot. They have a much higher risk of getting infected because of their jobs, but they might be afraid to speak up if they get sick. They might worry about losing their jobs, or if they're undocumented, about getting in trouble with immigration.
That makes sense. They're kind of stuck between a rock and a hard place.
Exactly. Professor Carpiano suggested that we need to find ways to reach out to farm workers outside of their workplaces through community organizations they already trust, and maybe even find ways to incentivize farmers to cooperate with disease monitoring, like offering them financial compensation for testing and reporting.
That's a really good point. We need to make sure everyone feels safe coming forward, regardless of their job or immigration status. So we've talked a lot about the potential risks, but let's be clear about what we know for sure right now.
Yeah, it's important to remember that as of right now, human cases of bird flu are still relatively rare, and most of them are happening in people who've had direct contact with infected animals.
There's no evidence yet that it's spreading easily between people.
That's correct. Scientists are watching for any signs of that, but so far it's not happening.
And the chances of it mutating into something that can spread easily between people, we don't know for sure what those chances are.
Right. We don't know when or if that will happen. It's something that researchers are constantly monitoring.
And going back to the public awareness thing, it's clear that there are some gaps in what people know about the risks of raw milk and how this bird flu situation is unfolding.
Definitely. And it's not always easy to get accurate, up-to-date information out to everyone, especially when things are changing so fast.
You mentioned earlier a study about raw milk and mice. Can you tell us a bit more about that?
So in this study, researchers found that mice could get infected with bird flu after drinking raw milk from cows that had the virus.
So it's possible to get it through milk.
It seems so, at least for mice. The Food and Drug Administration is still looking into whether it's a direct risk for humans who drink raw milk, but this study definitely suggests that it's possible for the virus to be transmitted that way.
Which is another reason why people shouldn't be drinking raw milk, right? There are already so many risks associated with it.
Exactly. This just adds another layer of concern. So, with all this information in mind, what are some of the key takeaways from our experts?
Yeah, what should our listeners be thinking about?
Dr. Jacobs really stressed the importance of being cautious, especially for people who work with poultry or cattle. They need to wear the right protective gear and follow strict decontamination procedures to minimize their risk.
And for the general public?
For everyone else, it's important to avoid contact with sick or dead animals, and definitely don't drink raw milk.
Good advice. Anything else from Dr. Jacobs?
Yeah, she mentioned that there are antiviral medications available that can help treat bird flu infections in humans. They work best if they're given early on, and luckily, most people who've gotten infected have had pretty mild symptoms.
So it's treatable, which is good news. What about Sarah Clark, the co-director of the Mott poll? What were her main points?
Well, she emphasized how important it is for health officials to be upfront and honest with the public, to be clear about what they know, what they don't know, and what they're doing to address the situation. She said that building trust is crucial, especially when there's so much fear and uncertainty.
And for parents specifically.
She advised parents to make sure their kids are washing their hands properly, and to make sure all food, especially meat and eggs, is cooked thoroughly. And of course, to only give their kids pasteurized dairy products.
So as we wrap up this deep dive, what are the biggest things you hope our listeners take away from this conversation?
First and foremost, be really careful about where you're getting your information. Stick to reliable sources like government health agencies and trusted medical professionals. Don't just believe everything you see on social media.
Good point. It's easy to get caught up in all the noise and misinformation online.
And second, be really cautious about raw milk. It's just not worth the risk.
Agreed. And if you work with poultry or livestock, be extra vigilant about safety. Follow all the guidelines, use your protective gear, don't take any chances.
Absolutely. Your health is worth it.
And one final thought for our listeners. Given how connected human and animal health are, what are some ways we as communities can be better prepared for future health threats? How can we support the people who are on the front lines, like our farm workers? It's something to think about, to discuss, to act on. Thanks for joining us for this deep dive. We hope you found it informative.
Thanks for having me.
Thanks for tuning in to the Health Headliner podcast by To Digital. Like and subscribe for more health news and breakthroughs. Stay healthy and informed. See you next time.